Ever wondered why conjunctivitis, also known as pink eye, is such a common occurrence? Well, let's dive right in. Conjunctivitis, or as we commonly refer to it, pink eye, is a frequent eye condition, affecting people from every age group. Imagine it as an uninvited guest, showing up without warning, regardless of season or reason. Now, to understand this condition, we need to get to know a part of our eye better, the conjunctiva. This is a thin, transparent layer of tissue lining the inner surface of your eyelid and covering the white part of your eye. Think of it as the eye's protective shield. But when this shield gets inflamed or infected, it results in the condition we know as conjunctivitis. So yes, conjunctivitis is common, but it's often misunderstood, leading to unnecessary panic. But don't worry, knowledge is power. Stick around to learn more about this common but often misunderstood condition. You may be wondering, what exactly triggers this inflammation or infection of the conjunctiva? Well, let's dive right into the various sources of conjunctivitis, commonly known as pink eye. One of the main culprits behind conjunctivitis is bacterial or viral infections. Now you might ask, how does one get a bacterial or viral infection in the eye? It's simpler than you'd think. It might be as straightforward as touching something that has the bacteria or virus on it, and then touching your eye. That's why it's so important to wash your hands regularly and avoid touching your eyes as much as possible. Another common cause of conjunctivitis is an allergic reaction. This can be triggered by a variety of factors like pollen, dust mites, mold, or pet dander. For some people, even certain types of eye drops or contact lens solutions can cause an allergic reaction leading to conjunctivitis. So if you're prone to allergies, it's crucial to be aware of what triggers your symptoms to avoid any unnecessary discomfort. In babies, conjunctivitis can sometimes occur due to an incompletely open tear duct. This isn't as common, but it's still worth mentioning as it can cause a lot of worry for new parents. Perhaps the most significant thing to note about conjunctivitis is its contagious nature. If the condition is caused by a bacterial or viral infection, it can easily spread from person to person. This means that if you or someone in your household has conjunctivitis, it's crucial to practice good hygiene to prevent its spread. This includes not sharing towels, pillows, or eye makeup, and always washing your hands thoroughly. The causes of conjunctivitis are many and varied, but by understanding them, we can put into place preventative measures to reduce the risk of infection or irritation. Remember, our eyes are delicate and sensitive, and they deserve our care and attention. Understanding these causes helps us to prevent the spread and occurrence of conjunctivitis. So, let's keep our eyes healthy and happy by being mindful of these triggers and practicing good hygiene habits. But how can one identify conjunctivitis? What are the telltale signs? Well, it's not as complex as you might think. Conjunctivitis, commonly known as pink eye, often presents itself through a variety of symptoms. One of the most noticeable symptoms is redness in the white of the eye or inner eyelid. Imagine the white of your eye turning a shade of pink or red, rather like a sunset. This is often one of the first signs that you may be dealing with conjunctivitis. Another symptom to watch out for is an increased amount of tears. Your eyes might suddenly become a waterfall, tearing up more often than usual. This is your body's way of trying to flush out the irritant causing the inflammation. Now let's talk about discharge. Conjunctivitis can cause a thick yellow discharge that crusts over the eyelashes, especially after sleep. Yes, it's as unpleasant as it sounds, but it's an important symptom to be aware of. This discharge is often a result of bacterial conjunctivitis, and it can sometimes be so severe that it glues your eyelids shut. Are your eyes feeling itchy or burning? That's another common symptom of conjunctivitis. It's as if your eyes are begging for attention, making it hard to focus on anything else. It's a sensation that's hard to ignore, and it's your body's way of telling you that something isn't quite right. Blurred vision is another sign to watch out for. It's as if you're looking through a foggy window. Everything seems hazy and out of focus. This can occur when the inflammation from conjunctivitis affects the clear layer of tissue covering your eye, known as the cornea. Lastly, if you notice an increased sensitivity to light, it might be a symptom of conjunctivitis. Bright lights can suddenly seem blinding, causing you to squint or close your eyes. Recognizing these symptoms early can lead to prompt treatment and prevent further complications. So keep an eye out for these signs and symptoms. Your eyes will thank you for it. Now that we know the causes and symptoms, let's explore the treatment options for conjunctivitis. When it comes to treating conjunctivitis, it's important to remember that the best course of action depends on the specific cause. If an allergy is the culprit, Over-the-counter eye drops or antihistamines can often provide relief. These treatments work by reducing inflammation and soothing the itchy, watery eyes associated with allergic conjunctivitis. If bacteria is the cause of your conjunctivitis, your healthcare provider might prescribe antibiotics. These could be in the form of eye drops, ointments, or oral medication. Remember to always follow your healthcare provider's instructions carefully and complete the full course of medication, even if your symptoms start to improve. On the other hand, if a virus is causing your conjunctivitis, antibiotics won't help. Viral conjunctivitis usually resolves on its own within a couple of weeks. In the meantime, you can take steps to soothe your symptoms. Cool or warm compresses can provide relief, as can over-the-counter eye drops designed to lubricate and soothe the eye. Regardless of the cause, it's crucial to avoid touching your eyes and to wash your hands regularly to prevent the spread of conjunctivitis. Everyone's experience with conjunctivitis is unique, and what works best for one person may not work as well for another. Remember, the right treatment depends on the cause of the inflammation or infection. Conjunctivitis, although common, can be prevented and treated effectively. We've covered a lot today, from understanding what conjunctivitis truly is to exploring its various causes. We've also looked at the symptoms to watch out for and discussed the available treatments. The key takeaway here is that knowledge and vigilance are your best defenses. Stay vigilant, take care of your eye health, and always consult a healthcare professional if you suspect you have conjunctivitis.